I've been a nurse for 12 years, and I thought I'd seen everything. Heart attacks, overdoses, domestic violence cases that made me sick to my stomach. But nothing prepared me for what happened during my rotation at St. Mary's General last winter. I was working the graveyard shift in the ICU, 11 p.m. to 7 a.m. It was just me, another nurse named Carol, and Dr. Martinez making rounds. The ICU had 8 beds, but only 3 were occupied that night. Room 302 had Mrs. Allison, an elderly woman recovering from surgery. Room 304 was Mr. Thompson, a construction worker who'd fallen from scaffolding. And room 308 had been empty when I started my shift. Around 1 a.m., they brought in a Jane Doe, middle-aged woman, found unconscious in her apartment by a neighbor who'd called about a gas leak. Carbon monoxide poisoning, but she was stable. They put her in room 308, and I was assigned to monitor her vitals every hour. The first few checks were routine. Her oxygen levels were improving, heart rate steady. But around 4 a.m., something felt off. When I walked into room 308, the temperature had dropped noticeably. My breath almost misted, which was impossible. The hospital's heating system kept everything at a constant 72 degrees. The woman was awake, staring at the ceiling with wide, unblinking eyes. I'd seen patients come out of unconsciousness confused before, but this was different. Her pupils were dilated, and she had this expression like she was seeing something terrifying that I couldn't see. "How are you feeling?" I asked, checking her IV line. She didn't respond, just kept staring upward with that horrible frozen expression. I followed her gaze to the ceiling tiles above her bed. Nothing there but the same water-stained acoustic tiles that covered the entire ICU. I tried talking to her again, explained where she was, what had happened. Nothing, not even a blink. Her vitals were normal. That was the strangest part. Heart rate, blood pressure, oxygen saturation, all perfectly stable. But everything about her radiated terror. I called Dr. Martinez, who came to examine her. He checked her reflexes, shined a light in her eyes, asked her basic questions. She remained completely unresponsive, still staring at that same spot on the ceiling. He ordered some additional tests and told me to continue monitoring her closely. Over the next 2 hours, I checked on her every 15 minutes instead of every hour. Each time she was in the exact same position, staring at the exact same spot. The room stayed unnaturally cold, and I started bringing a sweater when I went in there. But it was the other patients who really started to worry me. Mrs. Chen began pressing her call button repeatedly around 5 a.m. When I went to her room, she was agitated, speaking rapid Cantonese and pointing toward room 308. I don't speak the language, but her distress was clear. She kept shaking her head and making a shooing motion with her hands, like she was trying to ward something away. Mr. Thompson was worse. He was sedated, but he kept turning his head toward the wall that separated his room from 308. Even unconscious, he seemed restless, constantly shifting and making small distressed sounds. At 6 a.m., I went to check on Jane Doe one more time before the day shift arrived. The cold hit me as soon as I opened the door. It had to be at least 20 degrees colder than the hallway. I could see my breath now, small puffs of vapor in the air. The woman was still staring at the ceiling, but something had changed. There were tears streaming down her face, not the occasional tear you might see from an unconscious patient. Steady streams, like she was sobbing, even though her expression hadn't changed at all. Her face remained locked in that mask of absolute terror, but the tears just kept coming. I reached for the call button to page Dr. Martinez when she spoke. "Don't let them take me back." Her voice was barely a whisper, but it hit me like a physical force. She still wasn't looking at me, still staring at that ceiling tile, but she was talking. "Take you where?" I asked, leaning closer. "The apartment. They're waiting in the apartment." My blood went cold. The neighbor had found her unconscious due to a gas leak, a simple accident, but the way she said, "They're waiting," made my skin crawl. "Who's waiting?" I whispered. She finally turned her head to look at me, and I had to grip the bed rail to keep from stepping back. Her eyes were completely black, not just the pupils, but the entire visible eye. It was like looking into two holes, the ones who turned on the gas. I stumbled backward, hitting the call button on the wall behind me. Dr. Martinez's voice crackled through the intercom, but I couldn't take my eyes off the woman in the bed. She had turned back to staring at the ceiling, and her eyes were normal again, brown, with regular pupils that reacted when I moved my pen light. "Nurse Patterson, what's the situation?" I looked around the room. The temperature felt normal again. The woman appeared to be sleeping peacefully, no more tears, her breathing steady and calm. Everything looked exactly like it should in a normal ICU room. False alarm. Sorry, doctor. When the day shift arrived at 7, I gave report and left as quickly as possible. I tried to put it out of my mind, told myself it had been a long night and I was tired. But I called the hospital the next evening to check on the patient. Room 308 was empty. Jane Doe had been discharged that morning. According to the day nurse, she'd woken up around 8 a.m. completely lucid, remembered her name and address, and showed no signs of cognitive impairment from the carbon monoxide exposure. A family member had picked her up. That should have been the end of it. But 3 days later, I saw a small item in the local newspaper. A middle-aged woman had been found dead in her apartment from carbon monoxide poisoning, the same address where our Jane Doe had been found. The article mentioned that police were investigating it as a possible suicide, but neighbors reported seeing her walking around the building that morning, seeming perfectly healthy. The gas had been turned on sometime after noon. I never worked another shift at St. Mary's General. I transferred to a different hospital across town, and I never talked about what happened that night. But sometimes, when I'm working late and the ICU gets very quiet, I find myself looking up at the ceiling tiles and wondering what she saw up there. And I always make sure the room temperature feels right. I've always been claustrophobic, so when my doctor ordered an MRI for my chronic headaches, I was already dreading it. But what happened during that scan still keeps me awake at night, 6 months later. The appointment was at Westside Medical Imaging, a small clinic attached to the main hospital. I'd been there before for x-rays, so I knew the layout: a narrow hallway with a waiting room at one end and the imaging suites at the other. The MRI room was at the very back, past the CT scanner and the ultrasound rooms. I arrived early, hoping to get it over with quickly. The waiting room was empty, except for an elderly man reading a magazine and a woman about my age scrolling through her phone. The receptionist, a young guy with thick glasses, checked me in. and told me someone would call me back shortly. After about 20 minutes, a technician named Dave came out to get me. He was probably in his 50s, tall and thin, with greying hair and a tired expression. He led me down the hallway, explaining the procedure as we walked. "First MRI?" he asked. "Yeah, and I'm not looking forward to it. I don't do well in tight spaces." He nodded sympathetically. "Most people feel that way. The machine is loud, but we've got music you can listen to. Usually helps people relax. The scan should take about 30 minutes. The MRI room was smaller than I'd expected, dominated by the massive white machine that looked like a giant donut. Dave handed me a hospital gown and pointed to a changing area behind a curtain. "Change into this. Remove all metal, jewelry, belt, anything magnetic. I'll be back in a few minutes." I changed quickly and sat on the narrow table that would slide into the machine. The room felt cold and sterile, with that sharp chemical smell that all medical facilities seem to have. Dave returned and helped position me on the table, placing headphones over my ears. "What kind of music do you want?" he asked, fiddling with some controls on a panel. "We've got classical, jazz, soft rock. Whatever you think is most relaxing." He nodded and moved to the control room, which I could see through a large window. His voice came through the headphones. "Okay, we're going to start with some shorter sequences first, just to make sure you're positioned correctly. Try to stay as still as possible." The table began sliding into the machine, and my chest immediately tightened. The space was incredibly narrow, maybe 2 feet of clearance above my face. I closed my eyes and tried to focus on breathing as the first sequence began. The noise was overwhelming, even through the headphones. Not just loud, but strange. A rhythmic hammering mixed with electronic squealing that seemed to come from all directions. I'd read about it beforehand, but experiencing it was different. It felt like being inside a construction site. After the first few sequences, Dave's voice came through again. "You're doing great. About 20 more minutes to go. I'm going to start the music now." That's when things got weird. The music that came through the headphones wasn't relaxing at all. It was classical, but not any piece I recognized. The melody was discordant, unsettling, like it was composed specifically to create anxiety. The strings sounded sharp and painful, and there was an underlying bass note that seemed to vibrate through my entire body. I tried to ignore it and focus on staying still, but the music was making my headache worse. Combined with the claustrophobic space and the machine's hammering noise, it felt like torture. I was about to ask Dave to turn it off when I heard something else. Whispering. At first, I thought it was just part of the music, maybe vocals I hadn't noticed before. But as I listened more carefully, I realized it was separate from the classical piece. Quiet voices, multiple people, talking over and under the music. I couldn't make out words at first, just the rhythm of conversation. But gradually, fragments became clearer. "Can you hear me? He doesn't know. Look at his brain." I assumed it was Dave talking to someone in the control room, maybe discussing my scan with a radiologist. But why could I hear it through the headphones? The music was supposed to block out everything except what they wanted me to hear. The whispering continued, and I started to pick up more words. Something wrong with the patterns are. He's listening. That last phrase made my blood run cold. I opened my eyes and stared at the white ceiling inches from my face. Were they talking about me? Could they somehow tell I was listening to their conversation? I tried to turn my head slightly to see the control room, but the space was too narrow and Dave had told me not to move. All I could do was lie there and listen as the voices continued. Been like this for other patients, getting worse. The classical music had stopped, but the whispering was getting louder, more urgent. I could now hear what sounded like dozens of voices, all talking at once. Some sounded like medical professionals discussing cases, but others were different. Patients maybe, or family members. Help me. Can't get out. Trapped in here. I was starting to panic. The space felt even smaller than before, and the voices were becoming overwhelming. I needed to get out, to tell Dave something was wrong with the audio system. I was about to call out when his voice cut through the chaos. How are you doing? About 10 more minutes. Dave, I called out, my voice cracking slightly. There's something wrong with the music. I can hear voices, conversations. There was a pause. Then, voices? What kind of voices? People talking. Medical staff, I think. And patients. It's very distracting. Another longer pause. I'm not sure what you mean. The music channel is clean. Just the classical playlist. No voices. I'm definitely hearing voices. Multiple conversations happening at once. Let me check the system. I heard some shuffling sounds, presumably Dave examining his equipment. Everything looks normal on my end. The music feed is clear. Are you sure it's not just part of the classical pieces? Some of them have choral elements. No, these are conversations. People talking about patients, about brain scans. Silence from the control room. Through the machine's hammering, I strained to hear what Dave might be doing. Finally, his voice returned, and it sounded different, more cautious. I'm going to pause the scan for a moment. Just lie still. The hammering stopped, leaving only the whispered conversations in my headphones. But now I could hear them even more clearly, and what they were saying made no sense. The headaches started after. Same pattern as the others. Doesn't remember the accident. Family never told him. Brain trauma from the car crash. 3 years in a coma. He thinks it's only been 6 months. I felt like I was falling, even though I was lying flat on my back. Car crash, coma. What were they talking about? I'd never been in any accident. My headaches had started 6 months ago, completely out of nowhere. Dave, I called out, my voice echoing in the narrow tube. Dave, I need to get out of here. No response. I couldn't see the control room from inside the machine. Couldn't tell if he was even there. The whispered conversations continued. Doesn't know his wife. Thinks she's still alive. Keeps asking about the headaches. We can't tell him. Not ready to know. I started hyperventilating. This couldn't be real. These people were talking about someone else, not me. My wife was fine. I talked to her that morning before leaving for the appointment. She was at work, probably worrying about how my scan was going. But even as I thought this, I realized I couldn't clearly remember talking to her that morning. In fact, when I tried to picture her face, it was strangely blurry, like trying to remember a dream. "Dave!" I screamed. "Get me out of here!" The table suddenly lurched, sliding me out of the machine. I sat up quickly, ripping off the headphones and looking around wildly. The room was empty. No Dave, no technicians, nobody. I jumped off the table and ran to the control room. The door was unlocked, but the room was dark, all the equipment powered down. There was a thick layer of dust on the control panel, like it hadn't been used in months. I stumbled back into the hallway, still wearing the hospital gown. The entire imaging center was empty. No staff, no other patients, no sounds of activity. The waiting room was dark, chairs stacked against the walls. A sign on the reception desk read, "Westside Medical Imaging, permanently closed." I don't remember leaving the building or getting home. The next thing I knew, I was sitting in my living room, still in the hospital gown, staring at a photograph on the side table. It was a picture of me and my wife on our honeymoon 5 years ago. But her face looked wrong somehow. Older than I remembered, and sad in a way that didn't match my memory of that happy trip. I called her cell phone. It went straight to a number that had been disconnected. That was 6 months ago. I've tried to find records of my appointment at Westside Medical Imaging, but according to everyone I've talked to, that clinic has been closed for over 3 years. I've tried to find Dave, the technician, but no one by that description ever worked there. My headaches are getting worse, and sometimes I hear those whispered voices even when I'm not in any kind of medical facility. They talk about brain scans and comas and accidents I don't remember. They mention my wife like she's someone I should know, but don't. Last week, I found hospital discharge papers in a box in my closet. They're dated 3 years ago, and they're for a patient who was in a coma following a severe car accident. The patient's name is mine, but I don't remember signing these papers or being in any hospital. I've scheduled another MRI at a different facility, hoping to finally get some answers about my headaches. But I'm terrified of what I might hear in those headphones, and what I might finally remember when I do. I started volunteering at Children's Hospital because I thought it would be rewarding, helping sick kids, bringing a little joy to their difficult days. I've been doing it for about 2 months, reading stories in the pediatric ward and helping with art projects when I met Emma. She was 7 years old, in room 412, with acute lymphoblastic leukemia, thin as a bird, completely bald from chemo, but with these incredibly bright green eyes that seemed too large for her pale face. Despite everything she was going through, she had this infectious smile that lit up the entire room. "Are you the story lady?" she asked when I first introduced myself. "I am. What kind of stories do you like?" "Scary ones," she said without hesitation, "but not too scary. Just scary enough to be exciting." That surprised me. Most of the kids wanted fairy tales or adventure stories. But Emma had been in the hospital for 6 weeks, and I figured she was probably bored with typical children's books. "I think I can find some good scary stories for you," I told her. Over the next few weeks, I became a regular visitor to room 412. Emma and I would spend hours together. I'd read her ghost stories and mystery books appropriate for her age, and she'd tell me about her dreams and the things she imagined she saw in the hospital at night. "The elevators move by themselves sometimes," she told me one afternoon while I was helping her with a coloring book. "After visiting hours, when everyone's supposed to be asleep, I can hear them going up and down, but nobody's in them." I smiled. "How do you know nobody's in them?" "Because I asked Nurse Janet, and she said all the staff use the stairs at night so they don't wake up the patients, but the elevators keep moving." Emma had a vivid imagination, which I thought was wonderful given her circumstances. She told me about hearing footsteps in the hallway outside her room, about seeing shadows under her door, about conversations in empty rooms. I assumed it was a combination of medications, boredom, and the natural way children process stress. But after a few weeks, I started noticing things myself. The pediatric ward had a different atmosphere at night. I'd begun staying later, sometimes until 8 or 9 p.m, because Emma had trouble sleeping, and my visits seemed to calm her. The hallways became very quiet after the dinner trays were collected and most visitors left. That's when I started hearing the elevators. Emma was right. They did move constantly, even when the nurses were using the stairwells. I'd hear the familiar ding of arrival, the mechanical whir of opening doors, then closing doors, then the sound of the car moving to another floor, over and over, all evening long. One night, I decided to investigate. I told Emma I'd be right back and walked to the elevator bank at the center of the ward. There were 3 elevators, and as I stood watching, the middle one arrived without being called. The doors opened to reveal an empty car, waited for the standard interval, then closed and moved on. I waited for about 10 minutes, and it happened 3 more times with different elevators. Empty cars arriving at the pediatric floor, opening their doors to no one, then continuing their mysterious routes. Weird, right? I turned to find one of the night nurses, a woman named Sandra, who I'd spoken with a few times. "Does this happen often?" I asked. She shrugged. "Every night, far as I know. Started about 2 months ago. Maintenance has looked at it a dozen times. Can't find anything wrong. The elevators respond normally when you call them, but they also make these phantom trips. 2 months ago. Yeah, right around the time." She paused, looking uncomfortable. "Around the time what?" Sandra glanced around, making sure no one else was listening. "Around the time we lost a patient, little boy named Michael. He was 8, same diagnosis as Emma. His room was right down the hall from hers." She pointed toward the end of the corridor, past Emma's room. I could see the door from where we stood, room 418. "What happened to him?" "Complications from his treatment. He coded around midnight, and we couldn't get him back. It happens sometimes with these kids. Their systems are just too compromised to handle the chemo. But Michael..." She shook her head. "Michael was terrified of elevators, refused to ride them, even when we needed to take him for scans or procedures. We always had to use the service elevator at the far end, the bigger one that didn't feel as claustrophobic to him." An empty elevator arrived as we were talking, doors opening and closing on empty air. "You think there's a connection?" I asked. Sandra looked at me like I'd suggested something ridiculous, but her expression softened. "I work nights in pediatric oncology. I've seen enough to keep an open mind about things that don't have logical explanations. All I know is the elevator started acting up right after we lost Michael, and they haven't stopped since." I went back to Emma's room, but I couldn't concentrate on the story I was reading to her. She seemed to sense my distraction. "Did you see the elevators?" she asked. "Yeah, I saw them. Your nurse Sandra told me about Michael." Emma's expression grew serious. "Michael's still here." "What do you mean?" "I see him sometimes, in the hallway. He looks the same as when he was sick, but different. Like he's trying to tell me something, but he can't talk." I felt a chill run down my spine. "Emma, You know Michael isn't really here anymore, right? Sometimes when we're sick or on medication, we can imagine things that seem very real. She gave me a look that was far too mature for a 7-year-old. I know the difference between real and pretend. Michael is here, and he's scared. Over the next week, I found myself paying more attention to the details Emma mentioned. The footsteps in the hallway at night, the shadows under her door, the conversations in empty rooms. And I started experiencing some of these things myself. The footsteps were real. I could hear them clearly during my evening visits. Slow, shuffling steps that didn't match the quick, efficient pace of medical staff. They always seemed to start near room 418 and move toward the elevator bank, then back again. The shadows were real too. Light from the nurse's station created shadows under all the doors, but the shadow under Emma's door moved differently, like someone was pacing back and forth in the hallway, stopping periodically right outside her room. One evening, I decided to stay later than usual. Emma had fallen asleep around 8 p.m, and I was sitting quietly beside her bed, reading to myself, when I heard a voice in the hallway. It was a child's voice, young and frightened. "I can't find my room. Can someone help me find my room?" I looked at Emma, still sleeping soundly. The voice came again, clearer this time. "Please, I don't know where I'm supposed to go." I got up and opened the door to the hallway. It was empty, except for a nurse at the far end, updating charts at the mobile workstation. She was too far away to have heard what I heard, and besides, she was clearly occupied with her work. "Hello," I called softly. "Is someone there?" No response, but I heard the shuffling footsteps moving away from me, toward the elevators. I followed the sound, my heart pounding. The footsteps stopped at the elevator bank, and a moment later, one of the cars arrived. The doors opened, and for just a second, I swear this is true, I saw a small figure inside. A boy, maybe 8 years old, thin and pale, wearing a hospital gown. He looked directly at me with enormous, frightened eyes, and then the doors closed. I stood there for several minutes, waiting for the elevator to return, but it didn't. Finally, I went back to Emma's room. She was awake, looking at me with those bright green eyes. "You saw him, didn't you?" she said. I didn't know how to answer. "Emma, what do you think Michael wants?" "He wants to go home, but he doesn't know how. He keeps trying to use the elevators, but they don't take him where he needs to go." "Where does he need to go?" "Not down to the lobby, upper. But the elevators only go to the roof, and that's not high enough." The next day, I asked Sandra about the hospital's layout. The pediatric ward was on the 4th floor, and there were 3 more floors above it: surgery suites, administrative offices, and storage. The roof was the 8th floor. "Has anyone ever checked the upper floors at night?" I asked, "when the elevators are acting up?" Sandra looked at me curiously. "Checked for what?" I didn't know how to explain without sounding crazy. Just anything unusual. That evening, I convinced Sandra to come with me to investigate. We took the stairs to the 7th floor, administrative offices that were empty at night. The hallway was dark except for emergency lighting, and everything was quiet. Then we heard it, the shuffling footsteps directly above us. "There's nothing on the 8th floor except the roof access," Sandra whispered, "and that door is always locked." We climbed to the 8th floor. The roof access door was indeed locked, but we could hear the footsteps continuing above us, on the roof itself. Sandra had keys for the access door, part of her security responsibilities, and after a moment's hesitation, she unlocked it. The roof was flat, empty except for HVAC equipment and a few maintenance structures. But in the center, directly above the pediatric ward, we could see small, bare footprints in the thin layer of dust and debris. They led from the access door to the edge of the building, then stopped. We stood there for several minutes, listening to the wind and the distant sounds of the city below. Then Sandra's radio crackled. She was needed back on the ward. As we headed back to the access door, I heard the voice again, very faint, like it was coming from far above us. "I can't find my room. Can someone help me find my room?" I looked up at the empty sky and felt my heart break. The next week, Emma's condition took a turn for the worse. She was moved to the ICU, and I wasn't allowed to visit. I learned from Sandra that she'd developed an infection, and her weakened immune system was struggling to fight it off. I never saw Emma again. She passed away 3 days later, early in the morning, while I was at home sleeping. But the elevator activity stopped that day. According to Sandra, they'd been operating normally ever since Emma died. No more phantom trips, no more empty cars making mysterious rounds. I don't volunteer at the hospital anymore. I tried going back once, about a month after Emma's funeral, but I couldn't make it past the lobby. Every time I heard an elevator ding, I thought about Michael searching for his room, and Emma trying to help him find his way home. Sometimes I wonder if she succeeded. I hope she did.